All right, what's going on, guys? We are here with Gaige, a coach at Centered CrossFit, but also a doctor of physical therapy. Is that right?
Yes, correct.
Awesome. And Gaige has just recently went out on his own and started a company called RPT. Gaige, why don't you tell us a little bit about your background and just a little bit about you?
Yeah, so I've seen a lot of you guys here at the gym for a while now, since we have been moved back to the area. My wife is from Tip City, and I'm from Delphus, Ohio. So grew up, born and raised Northwest Ohio. That's where I am from, and played football there, played sports growing up.
What hobbies do you do outside of the gym?
So drink a lot of coffee, and then my wife and I have a 1-year-old son. So just kind of experiencing first with him and just life and trying to figure out all that comes with that. And we have a dog as well that we stay pretty active with. We like to
What kind of dog
run,
is it?
we like to hike.
What kind of dog?
His name's Finn. He's a German short-hair pointer. So he's got a lot of energy for anyone who knows
Nice.
what that is. He's like a bird dog.
Cool. So what is one thing, like why did you get into PT, and what made your passion or love for PT kind of develop?
Yeah, so physical therapy was always like near to my heart because I was injured a lot growing up. So I dealt with a lot of injuries. Basically, like anywhere from head to toe, I've probably had something. I've probably been in some kind of splint or cast or sling.
Yeah.
Fortunately and unfortunately, because it led me to where I am today. But then also it basically kind of, took me in and out of sports, and all the psychological aspects of that come with being injured too. So,
So is this something you would say you've always wanted to do from the kind of very beginning?
It's definitely been something that's been like on my heart for sure. I think when I was getting into the profession and trying to figure out what I wanted to go to school for, it was always in the picture. And then when I went the route of pre-physical therapy and got into grad school, like I just knew it was like my bread and butter. Like especially when I got to interact with people on a like hand-to-hand basis and kind of just got to experience that personal relationship aspect while trying to help someone, and then getting to tie clinical knowledge and all the nerdy stuff that I like about the human body to it as well.
So what do you enjoy most about helping people, whether it's in like the fitness industry or whether it's through like rehabbing injuries or just with physical therapy in general? Like what brings you joy? Like what do you like to see kind of the most?
Yeah, I think the biggest thing for me is watching individuals pursue their own goals. So I think like collectively, like especially in a CrossFit gym, like we're always trying to better ourselves. But like your goals versus my goals versus someone who's 70, right? Like their goals are going to look so different. So I like the individuality and just like the variability that comes with that. So for me, I get super pumped about helping someone maybe get up and down off the floor unassisted, right, without using their hands for the first time, because they're developing mobility and then the strength in their legs, right? That might translate for them to be able to hang out with their grandkids in the same way that someone might be able to hit 315 on a front squat, right? Like after a tendonitis in their knee or something. So like that's what kind of like really gets me going, is being able to see those little wins for everyone individually.
Cool. Next, we want to ask Gaige and kind of get to know him. And since he's gone out on his own, he started this company, RPT, which stands for Revival Performance Therapy.
Yep.
Why don't you go ahead and tell us a little bit about why you named it that, why the logo, why you chose what you chose?
Yeah. So Revival Performance Therapy, for me, I wanted to have something that was inclusive of who I am as a person and touch on a little bit of my faith. And I think there's a lot that can happen from revival of performance and vitality in a physical sense that can also lead into a spiritual sense too. And really just kind of tying that into kind of who we are as everyday people and individuals, and getting to be a positive light for others to see as well.
Yeah.
So.
Cool. So where did you go to college at? I see some diplomas up here from the University of Findlay.
Yep.
So I assume that's maybe one of the places, if not more. So where did you go to college at? And then maybe tell me where you have worked or maybe interned or things like that before coming to here.
Yeah. So like I said earlier, I grew up in Delphus, which is a small school up in Northwest Ohio, and decided that I wanted to go to Findlay. So University of Findlay, not too far from where I grew up, And I went there and did a 3+3 program. So basically did 3 years of undergrad and then went right into 3 years of grad school, where then I got my DPT, my Doctorate of Physical Therapy degree. And then during that, in grad school and undergrad, I was getting involved in CrossFit. So I got my level 1 and was coaching at the local local CrossFit gym there, which is cool.
Yeah.
And then additionally, we had a program called Oiler Fit, is what we called it, which was through the university. And then we partnered with the gym to offer university students the chance to come to the CrossFit gym, usually like 2 to 3 times a week to do some classes as well. So I was doing that. And then in grad school, which is 3 years long, we do clinicals. Yeah. So over the course of those 3 years, it was COVID times, so things were a little bit different in how they were organized and when they happened. But I did a clinical at the Dayton VA, which was awesome, in the hospital. I did some outpatient rotations that focused more on like sports and performance and like everyday orthopedics. And then my last clinical was in more of an outpatient like performance type setting, where I was able to work with some chiropractors and like gain some knowledge from them, massage therapists, other PTs as well too. So that was
when you were doing, quick question, when you were doing the Oiler Fit, were you coaching that, or were you just were you taking classes type thing?
Both, yeah. So I'd coach it. It was myself and then one of our other coaches, Bree. Nice. So, and she's actually the one who was able to start it, which was awesome. So she started that whole kind of program. And that was essentially like a CrossFit class that you guys did on university or on campus? Yep. So we offered it at our CrossFit gym at the time, and then it was just extended to the university students to be able to come take that. And there was just like a set aside time for them, usually 3 times a week.
That's awesome. That's cool.
Yeah, it was cool. It was neat.
So what like certifications or maybe background, do you bring to the gym? So obviously the gym is right outside these doors, and here is your, let's say, space where you make, your magic happen. Like you obviously have a degree, right? A master's degree, a doctorate degree, right? Maybe elaborate a little bit on that.
Yeah. So after I finished my DPT, I decided to pursue a residency as well. So it's not required in our field. So after I got my doctorate, I took a position with Chapel Hill, UNC Chapel Hill, to do an orthopedic residency. So decided to do that just to kind of pursue more clinical expertise, like be around people who know what they're doing more than I do, and try and like pick up on like, hey, what makes them good, right? Or maybe learn from them of what they stumbled through their first like few years of practice.
So who did you mainly work with when you were there?
So it was a lot of like general population, some like student body as well, and then like ex-athletes in the area too. So some of the university teams were a little, I would say, like off limits. They usually got treated by most of the athletic training staff and people who were like actually on the teams. But it was a really great experience overall. And then I was able to like teach a little bit inside their DPT program as like a lab assistant. And so kind of getting immersed in that realm of teaching a little bit as well too. And then, go ahead.
So a little fun question is, what body part, or let's say what area of the body do you maybe say is your favorite to maybe work on or help someone maybe rehab?
Yeah, I think for me, shoulder is really fun. So are knees. There's a lot that I think is enjoyable. The shoulder I think is really fun because it tends to be a joint that can get angry quickly, but then we can also really, really make some quick impact through some of the things that I've picked up on and utilized through different types of hands-on technique, dry needling interventions, and we like to make their shoulders less angry and get them back out on the floor. So I like that because it's kind of a complex joint, but usually we can get people feeling quite a bit better, and then make sure they're staying out there performing hard.
So I noticed when I look around the room, you have many different tools that you use, whether it be cupping, I believe you do needling as well, you do some like bunch of banded work, compression, rehabilitation things, stem. Maybe elaborate more on maybe some of those aspects that you can offer, whether it be for the shoulder, knee, that type of thing. Yeah.
So when I work with individuals, it's typically like an hour-long session, and it's always one-on-one, meaning you're going to get my utmost undivided attention. And we're going to use any strategies or tools that we need to help you get the goals that you're looking for and get you back on track as quickly as possible. So that might include dry needling with some stim. It might include some muscle electrical stimulation with patches and programs that we utilize with the device. It might include scraping, cupping, right? Other just like adjustments or different things with my hands, as well as like I'm also offering a more compact service that's going to be more just recovery based. So it's just going to be just really like a short and soft tissue for someone who feels like maybe they don't have an injury per se, or they don't need guidance, but they want to boost their performance. Yeah. So then you can come in and get some soft tissue work associated with that too. Maybe hit some compression sleeves for your legs, right? So
cool. I did have a question for you that popped up through that. I've been needled a few times, and I absolutely don't enjoy it at all. And if you've been needled, you probably feel the same way. So my question to you is, where are people the most whiniest at? Like when you needle someone, where can you almost guarantee that someone's going to be a little
If you've ever dealt with plantar fasciitis and had any needling in that area through the Achilles, any associated foot and ankle complex, I feel like that tends to be the most sensitive part.
Because I've had like my hamstring done, I've had my hip flexor, which my hip flexor has been the most sore.
A little spicy.
But my hamstring has been like the squirmiest.
Yeah.
So I'm sure the foot and ankle is pretty bad.
Yeah. Foot, plantar fasciitis and plantar fascia area, definitely sensitive. But there's different ways to go about the needling too to try and make it more comfortable, and it's never anything that I ever push on anyone.
You just don't tell
it's
them
usually
to suck it up.
No. It's only an adjunct to the recovery process, and if it's not right for you, it's not something that needs to be done.
Sure. Cool. So what's one common struggle you see people face in the gym, and like kind of how do you help them through that? So in CrossFit, we have several different let's say backgrounds, walks of life that come into the gym, as well as age, like demographic, right?
Yeah,
so
sure.
like there's everyone from, I would say even a teens program, right? All the way up through, 50, 60, 70, 80-year-old customers as well, people who do CrossFit. So what's like one common struggle do you see, or one area that maybe if someone focused on a little bit more, maybe their CrossFit experience might be a little better?
Yeah, so I think really touching base on that, the biggest thing is they have a lot of questions if they are experiencing an ache or a pain or maybe the start of an injury about what they can or can't do on the floor. And as coaches, obviously you, Lauren, Mindy, Tyler coach quite a bit more out on the floor than I do, but I'm out there a little bit. Yeah. Like I think this gym has an incredible foundation for our members that there's always an appropriate modification or scale available, right? Just like, hey coach, right? But they still kind of have things in their mind where it's like, oh, I don't even know if I should have done that workout, or I don't even know if I should have tried, box jumps, even though, Coach Jason told me to use the 20-inch side instead of the 24 today. It's like, I don't know if that's appropriate. So for me, I think making like small tweaks and adjustments and giving them more of a framework and guidelines to follow allows them to feel more confident in the rehab process while still being a part of the community out here, which we all enjoy that and showing up.
And I think that's super important that you say that, because a lot of people might ask, like, what is your role, right? Like my CrossFit coach like helps me with all that stuff. And as I would say most of us are super, super knowledgeable in many of these areas, I would say we're not experts, right? And that's why you being here is so important, because you bring the expertise to it, right? Like the fine details, you've seen many different things and know many more things in this area that where as a CrossFit coach, we've seen some things, but maybe we don't have, the perfect answer, and maybe that's where you step in and allow that to happen.
Yeah.
So, what advice would you give to someone just starting their fitness journeys? Maybe just new to working out in general, or maybe just like coming to the gym to do CrossFit for the first time?
Yeah. So first, just start. Just start. That's the easiest thing that you can do. It's the hardest thing you can do, but it's going to be the sort of momentum that you need to kind of get the ball rolling. Is just walk through the door, come talk to us, right? Like, we have the tools to try and help you reach the goals that you want to reach. Okay, it's going to take time, but just start. I mean, that's the best thing that you can do. That's the first thing to do. And then two would be like, less is more at first. And you have to understand that this is not an original quote. I've taken this from other podcasts, but like be consistently good rather than like occasionally great. So it's like, cool, like what if you can show up for yourself, 3 times a week to start. Maybe it's only 2. Like, you can see results with that. You can start to work towards your goals with that. And like, you can make really, really big change and impact different habits that you want to accomplish and acquire through that. So you don't have to be at the top of the leaderboard, right? You don't have to be the person who does the RX right off the rip. Like, just start, and then like, as your fitness catches up with you, then you can do the cool things when it's appropriate. So.
And I think that not only goes for the CrossFit aspect, but even like for what you do, in the sense that, hey, if you give someone exercises, it's like, hey, like, I don't expect you to go all out for one day. It's like, hey, like, you need to do these like 3 or 4 times a week and be consistent with it. And that's where we see a lot of progress.
Yeah.
So
the carryover for sure.
What is, as a you coach out on the gym and you do the physical therapy, what is like the number one question like you get? It's like, hey, my shoulder's a little achy. Like, what's wrong with it, right? Did it like tear my whole shoulder? Or like, what's like a funny thing that you get approached with maybe, or like the most common question that you might get?
I mean, typically,
this is on the spot. I haven't told you about this, but just off the rip.
Typically, like, to me, it's kind of like, oh, like, I've kind of been having this thing go on, and then it's like, yeah, it's been like 6 months. And they're like, what should I do? And it's kind of, and they're not expecting like a full, like, hey, this is the perfect, plan.
Yeah.
But it's kind of like, oh, like, yeah, this has definitely been going on for a while, and I kind of have been neglecting it, but like, what would you say, right?
Yeah,
or like, what do you think it is? And
just
and
like, oh yeah,
and,
it's
and
this,
I love
right?
to have those conversations and stuff, right? But then also it's kind of just the sense of like, well, it's like, if it's been going on for 6 months, like, I don't think I'm going to be able to tell you in like 2 sentences.
Right.
So.
It probably is a bigger picture type thing.
Yeah.
I think that's cool and important. I also think like it's funny that, some people in CrossFit, it's like, well, like, people get injured in CrossFit, right? And I would say injury is inevitable, like, no matter what you do. CrossFit, whether you run, like, there's so many runners that run many, many miles and they have injuries, right? Or just in life in general, right? Like, if you don't work out or you don't train at all, injury is inevitable. You are going to get injured no matter what you do. But the thing that is important is, how do we react to that, right? And like what you're saying, in the sense that, hey, this has been going on for 6 months. When you're just a step in here, like, right, you go through the door, you go through the bathrooms, and boom, there's Gaige, right? And you don't necessarily have like an open door policy, but in the sense that when something does happen, an injury, when something is nagging you, being proactive about it is what's important to get ahead of the game, versus like keep grinding on your shoulder or like your foot if you're having issues, right?
Definitely.
Being proactive about it and getting ahead of the game is a better way to handle those situations versus sitting back and maybe doing more damage.
Yeah, don't wait 6 months. So and like, I mean, like, if I'm with someone and it's not a great time to come chat, like, talk to anyone, you'll be able to get a hold of me, and then we can find that time to chat. But you can always come knock on the door, come on in, and feel free to ask me questions.
So on top of that, how do people find you, right? So obviously they can maybe catch you in the gym. Do you have a website? Can people fill out an inquiry? Do you have a phone number? Type of that. How can people get a hold of you?
Yeah, so being small and just kind of starting out, I have my email, which is just gaige@revivalperformancetherapy.com. Then I also have my number, which you can grab from one of the coaches or me personally, and then I'll make sure I reach out to you. And then building out a website right now, trying to put the content together. That way we can launch something that's hopefully user-friendly for everyone to be able to do bookings on and get the newsletter and some blog stuff that I'm going to put out.
Cool.
And then there is a way to find me online too. So if you just search Revival Performance Therapy, you might have to type in Tip City or like something like that, just to make it a little bit more local. Should be able to find like a Google profile there with some additional ways to get in and like book an account or just reach out.
Yeah. What's your Instagram?
So I have Revival Performance Therapy, which is RPT's kind of business account.
Yep.
And then I also have Dr. Gaige Rassman Fit. So
cool. What's your Facebook? Is this RPT?
I don't have a Facebook. Right
No
now.
Facebook.
Not a huge Facebook guy, but
just on Instagram, huh?
Yeah, just Instagram right now.
Cool.
Instagram, word of mouth.
So it could be something
organic.
maybe just send you a DM too.
Yeah, for sure. Yeah, you can DM. You can leave me a sticky note on the wall, right? Just slap.
So
my door.
as you're watching this, if you're sitting there and you're like, oh, my shoulder's been hurting me for 6 months, just send them a DM on Instagram. And,
and we can always,
solve your problems in 2 seconds.
Yeah, guaranteed. No.
Cool.
But we can always definitely like find a time to talk about things too, right? Like I don't want you to feel like you have to book a session to try and, you know, ask me questions, and we'll make sure it's a right fit for you. And if it's not, then like I'm always going to be the person to try and put you in a connection with someone who I think will be the best fit. So,
What do they call that? Hiding behind a paywall?
yeah,
right?
I'm not doing that. Yeah, no, I'm not doing anything.
Cool. Sweet. So yeah, Gaige Rassman, right? That's how you
Yes.
say it.
Yeah.
Gaige Rassman. Again, he's here at the gym. Feel free to reach out to him if you have any nagging issues, or if you're like, hey, just like, I like your story. I also went to the University of Findlay or something like that. Or maybe you did that same Findlay Fit, or what do they call it?
Oiler Fit.
Oiler Fit, yeah. And just, yeah, say hi. Cool?
Yeah.
All
And I
right.
would say, yeah, last thing is basically just, you know, whatever you need, it doesn't have to be a full-blown injury. If there's any aspect of just like performance coaching or things that you want to touch on, or even like recovery-based too. So it's something that we like to be proactive about,
Right.
like Coach Jason was saying. So, I mean, you can always tap into that to try and keep you moving in the right direction and have those touch points to prolong your CrossFit career and your longevity to keep crushing it outside the gym. So,
Yep. Cool. Sweet. Thanks.
thank you.